Okay, we are here to talk about the lovely stomach. So I'm gonna slide this out here. So this is the body of the stomach here, and then we've got the esophagus here. So we have the stomach that sits mostly on the left side here, and the liver is on the right, but comes over to the left side as well. We've got, this is actually, we're gonna call this a full stomach. So the stomach is actually a muscular bag. It's got a lot of muscle tissue that it's made of, but it changes shape and size often because as we're eating, it drops down. So that's why we're gonna call this a full stomach. So it's dropping down pretty low, but sometimes it's sitting a little bit higher up this way. And so we've got this muscular bag here that's really starting to kick off the digestive process. And we have tissue that comes from, this is called the lesser curve of the stomach. There's a tissue that comes up here and connects up to the liver called the lesser omentum. And then we've got the greater curve here, and this is where the greater omentum drops down, which we talk about a little bit more in the large intestine colon spotlight, because that greater omentum drops down over the abdomen and then loops back up and connects to the large intestine here. So we've also got behind the stomach is the pancreas. So things are very, let's say, just kind of close and connected in this area. And then we've got the vagus nerve that drops down and travels along the esophagus, and the lungs and the heart. The lungs and the heart tissue surround the esophagus. So when we look at dysfunction of the stomach, come under here, Betty. Dysfunction of the stomach, there's a lot of different players in something like acid reflux, indigestion, hiatal hernia, gastroparesis, H. pylori infection, stuff like that, because of how intertwined this organ is. And so even just a glucose imbalance or an insulin issue, similar to diabetes. So when we look at, let's talk through just hiatal hernia, for example. So we've got the diaphragm that sits underneath here. And so it can either be part of the esophagus and the stomach here that comes up through that area, or sometimes we can actually have the, it's called the fundus of the stomach that will actually slide up through that area, through the diaphragm, and that could be considered a hernia too. And so a lot of times the focus is here on this area that we call the gastroesophageal junction, where the stomach and the esophagus meet through the diaphragm. But when we look at let's say the pancreas on the back side, or even the spleen here on the side, how tension in those organs can actually contribute to that hernia. So we'll have patients come in who get this repaired, but they don't get the other areas moving, and so their symptoms continue. So it's pretty fascinating just to see how the body responds and reacts to tension that's created. So we've got that. We've got another thing that can really present with the stomach. We can definitely get shoulder issues just because of everything kind of traveling onto the left side. We can also get neck issues. So a lot of times when we're treating the stomach, we try to get, the esophagus is not over here, it's in the middle. We try to get the neck involved. So if someone's doing, if we're doing a stomach manipulation, having that neck rotation can help us treat the esophagus and help unglue any tension that might be from, let's say, the lung pressures are off and the esophagus is just crowded. The esophagus is the most posterior in relationship. We also have the trachea and the aorta running here, but it's very posterior. So it has the ability to just get kind of crowded from all of the tissue sitting in front of it. And because it sits so close to the spine, it can present as neck dysfunction, upper back dysfunction too. So just really getting that to move is helpful. And then we will also utilize some techniques with the sternum to help offload that area as well, to create a little bit more space and a little bit more like breath expansion up forward. So the stomach can really present in some of those musculoskeletal issues that we find. So another thing that we can see often is in our postpartum mamas, especially C-section, but also vaginal delivery, is they'll have tension in pelvic floor area here for years. So what'll happen is maybe when their kiddo is like 10 or something like that, they'll start to present with acid reflux. And what we tend to find is we have to work the pelvis first, because things have been essentially pulled down. There's been this low level tension on their stomach for many years, and you can imagine how irritating that would be if this is getting pulled down and your body's trying to digest food and balance acid production and all of that stuff. So what we tend to do is offload pelvis here, and the stomach can slowly start to settle back where it belongs, and the acid reflux will oftentimes resolve that way. So that's always an interesting one to look at, and this is why we try and do had one today, a 6 to 8 week postpartum check-in, because if we can try to catch some of those issues early on, it's really quite helpful. So hopefully this helps kind of wrap your head around the stomach a little bit more, and how everything is kind of situated in here, and just how much it can really tie into all of this entire area around the diaphragm. And we will see you next time for the next organ spotlight with Betty.